My name is Janice Boyanchek, and I was diagnosed first in 2011. The first time that I had breast cancer, they were very helpful. And ladies came up to me and told me that they had had it 10, 15, 20 years before and wanted me to know that this was not a death sentence.
I'm Shrividya Maharaj. I'm an attending physician here at the John B. Amos Cancer Center. I'm board certified in hematology and oncology, and I've been blessed to be here for a little under a year now. So early on in my medical career, I was able to witness firsthand what it means to lose somebody to cancer. My grandmother was diagnosed with esophageal cancer, and I witnessed it all from the moment she got her diagnosis, being in the physician's office, discussing her treatment plan, discussing goals of care, witnessing her go through chemotherapy and radiotherapy.
You're going to find friends that you didn't know you had. You will be surprised at the people who step up and offer you support. Be willing to accept the help.
Cancer doesn't discriminate, right? It can happen to anyone, irrespective of race, irrespective of socioeconomic status. And I think it's wonderful that John B. Amos is able to offer what we offer here. The care that our patients get here at the Cancer Center is phenomenal. You know, they come in as strangers and they leave as friends.
So that was a lot of support. And then 5 years later, I got breast cancer on the other side. And this time I did have to have chemo. And again, the ladies were so supportive. This was my main source of support. I have been very satisfied, very happy with the staff and the doctors at the Amos Center. They've done everything they could to make it a cheerful environment.
Cancer is a very difficult diagnosis, not just for the patient, but for their family and for their loved ones. Here at the Cancer Center, we've got a lot of resources for both the patients and their families. We have access to support groups, and our staff are phenomenal.
I think it's a calming atmosphere. The nurses and technicians go about their business, and they're very calm, and they help keep you calm.
Our goal at John B. Amos is to have every single patient who walks in that door with a diagnosis of cancer leave cancer-free and ringing that bell.
Be brave. Let yourself grieve. Go ahead and cry. And then find out as much as you can about what your treatment's going to be. Reach out to your friends, because you'll find out who has been through it before you. Don't be afraid to talk to them and share with them. I found it comforting to hear what other people's experiences were.
It is very important for women to support women during this journey. This year, our fundraiser will focus on obtaining the Pink Ribbon Comfort Bags, which will contain inspirational books and items to provide comfort and support for our newly diagnosed breast cancer patients here at the John B. Amos Cancer Center.
When it all was over, I had a luncheon at my house for all the ladies who helped me through that. There were about 20, 25 people. Some of them brought a casserole. Some of them, were smaller gestures of kindness, but it was all gestures of kindness and support. My name is Janice Boyanchek, and I'm a survivor.
If you haven't yet scheduled your mammogram and are due for one, please call the Elena Amos Breast Care Center.